So I'm thrilled to introduce Dr. Jamie Benham today. She's an assistant professor at the University of Calgary's Cumming School of Medicine and an endocrinologist with Alberta Health Services. Dr. Benham specializes in women's endocrine health, focusing on conditions like PCOS and gestational diabetes. Her research explores reproductive and cardiometabolic health, aiming to enhance patient care and well-being. So welcome, Dr. Benham, and thanks for taking the time to talk with us today.
Thank you so much for the introduction. I'm so happy to be here today to talk about PCOS.
Awesome. So I'm just going to start out with the question, what is PCOS?
So, PCOS, or Polycystic Ovary Syndrome, is a chronic condition that is both a reproductive and metabolic disorder. It affects people with ovaries, and women with PCOS are affected across the life course, which means they're affected throughout their life. People can present in different ways, but many affected individuals have irregular or absent menstrual periods. They might have high androgen levels like testosterone. And if an ultrasound was done of their ovaries, it might show polycystic ovaries. The name polycystic ovary syndrome, though, reflects the appearance of the ovaries as they're seen on the ultrasound, but doesn't really capture all of the components of what PCOS is and how it impacts people across their life.
Just how many folks does it impact, and also what age does it appear at?
So generally, PCOS can appear during adolescence and is often diagnosed in the reproductive age. So we say that's kind of anywhere between the time of the first menstrual period until menopause. Many people are often diagnosed when they're thinking about trying to become pregnant, might be when they see a specialist, but many are getting diagnosed in adolescence. It affects approximately 1 in 10 females.
Wow, that's actually a very large number. What are the symptoms?
So PCOS, there's a number of different symptoms. So people come to see us in clinic for lots of different reasons. Some of the main ones are a loss of menstrual periods or having irregular menstrual periods. So a menstrual period generally occurs every 21 to 35 days to be considered regular. And people with PCOS may have less menstrual periods occurring per year, so less than 8 per year. Other symptoms they can get can be symptoms of high androgen levels. So that would be excess hair growth in spaces that we may not typically see it in a female, or acne or hair loss. There's also a number of other associated symptoms like difficulty losing weight, insulin resistance, as well as anxiety and depression.
Wow. Does it impact a woman's ability to have a child?
So PCOS is associated with difficulty becoming pregnant or infertility. That often can be why people present to a doctor, because it's taking them a longer time to get pregnant than they might expect. However, PCOS over the lifetime, people with PCOS compared with those without have similar rates of fertility and the ability to get pregnant. People with PCOS, though, may require some help with medication.
What does PCOS do to our cardiovascular system?
So we know that PCOS is associated with a lot of different complications over the lifespan, and one of them is related to the cardiovascular system. So we do know that cardiovascular disease is increased in people living with PCOS. And what we see is during the reproductive years that people with PCOS have an increased risk of cardiometabolic risk factors that lead to cardiovascular disease. So things like type 2 diabetes, high cholesterol, high blood pressure, as well as excess weight. We know, for instance, that the risk of developing type 2 diabetes is 4 times higher in people with PCOS than people without, and that it occurs at a younger age. So it's really important to recognize that these cardiovascular risks exist, and for people with PCOS to get screened by their doctors for these risk factors so that we can diagnose them early and manage them to prevent complications.
Is there anything a patient can do to empower themselves to manage symptoms or decrease the risks of cardiovascular conditions?
So there's no specific treatment for PCOS, and a lot of the treatments that we offer are more related to symptom management. But in terms of preventing cardiovascular disease in this patient population, we know that the cornerstone is lifestyle management. So we know that maintaining a healthy weight across a lifespan, and the guidelines focus on preventing weight gain in times of stress. For example, starting a new job or moving to a new city, trying our best to optimize our weight at that time. As well, it's recommended that people with PCOS participate in regular physical activity. So that includes 150 minutes per week of aerobic exercise, things like walking or swimming, as well as strength training 2 times per week. In addition, it's recommended that people with PCOS follow a well-balanced diet. There is no specific diet recommendations or nutrition plans recommended for people with PCOS at this time, but those are kind of the cornerstones of our management kit for PCOS symptoms.
Awesome. And you are also a researcher, a very prolific researcher looking quite often into this condition, and you recently received a grant. So can you tell us about what you're doing in your lab?
Yes, we were delighted to receive some funding from the Canadian Institutes of Health Research to look at co-creating tools for people with polycystic ovary syndrome to help them to manage their PCOS through lifestyle. So with this research funding, we're looking to work with people who have lived experience with PCOS to design tools that would be accessible and useful for them in managing their symptoms. As an endocrinologist, I see people with PCOS in my clinic all the time, and I recommend all of our lifestyle management options that we have and what the recommendations are. And a lot of the questions I get back are, okay, great. So how do I do that? Like, you tell me not to gain weight. You're telling me to go exercise. I've never done that before. I've never been on a treadmill. We don't have the support set up with evidence-based recommendations for how people can take on these self-management recommendations that we're giving them. And so our goal with this research program is to work with patient advisors. So we're right now recruiting for people with lived experience in Alberta to be advisors for our team to help us to co-create these tools that would be useful for their PCOS care across the lifespan.
That's amazing. How can people find out more about this, being involved in the study?
Yes, so if people are interested, they can email our lab team. So it's embrace@ucalgary.ca, or we have a website as well, embracelab.ca. So our lab is the Embrace Women's Health Research Lab.
Thank you so much for taking the time today to share a little bit about this important topic, and congratulations on your amazing grant. And I think it's going to be a wonderful tool.
Thank you so much.